As we look for affordable healthcare, could retail clinics be the answer? We're at the INSEAD Alumni Healthcare Summit in London, and we're speaking with someone who founded a consortium of retail clinics in Scandinavia. Ville, Öhman, welcome to INSEAD Knowledge.
Thank you.
Now, your company is called Laastari.
Yes.
And what does that mean?
That's a Finnish word for bandage.
For bandage, okay. But your clinics actually just charge 45 euros per visit, and that includes all the tests, all the administration. You're open 7 days a week. How can you afford to do that? You don't even need an appointment, so how can you afford that?
We have a very different pricing model than traditionally in healthcare, so it's flat fee, everything included. And it's built like that because we have a predefined set of illnesses that we treat. Mm-hmm. They are acute and common illnesses like ear infection, eye infection, strep throat, allergies, vaccinations. And we have built the whole delivery model for those illnesses. So we know that when we treat an illness, it's going to be done for every patient exactly the same way. So there's a lot of predictability in it, which traditionally is not part of healthcare. And this way we can take the risk of pricing it flat instead of pricing for every procedure or test that would be done at the clinic.
And part of the reason it's largely run by nurses, but this is a little bit unusual in Europe because nurses can't prescribe, for example.
Right. So retail clinics in the US are run by nurse practitioners with prescription rights. In Europe, nobody did this before because you really need a physician to do the diagnosis and write the prescription. We solved it by building a telehealth platform which links the physicians remotely to these clinics that are located in shopping centers and pharmacies. We have a video link and we have a IT platform which is really actually a decision support system where the nurse at the clinic does all the examinations and the tests according to the medical best practice guidelines, following really like a checklist built on every illness, does all the tests, records into the system, and that data set gets sent or actually is accessible to physician remotely. So a physician gets these diagnostics data sets about clients or patients from different clinics, and that's a way to allocate the physician time in a very, very efficient way.
It sounds as though this would work, and clearly does because of your expansion, but it would work for people who are kind of overall healthy. But have you ever had any surprises? Somebody comes in with something that might just be a cough and you find that it's something much worse, or you find a real sickness, or I mean, if you're really sick, you wouldn't go to a retail clinic. We
have a treatment menu, which is really 13 illnesses that we treat, and we don't do anything else. So if it ends up that the patient has something else when they come to the clinic, or if we discover that they have something else, we would refer them to the right place, and then we would not charge for the visit. So we don't want to be an extra charge in the care path or the value chain, but rather charge if we can just take care of the patient case completely. It's actually diagnoses or illnesses that represent about 50% of primary care.
Now, who tend to be your patients? Is there an age bracket?
Typical patient is a 37-year-old woman. That's just an average, but we have a lot of families with children, and child ear infection is a perfect example. But basically it's working adults, working families who don't have time to wait, don't have time to book a time, lose a day of work, and go through all of the hassle of the traditional care. They just want to drive in and be out in 15 minutes.
This all looks very, very good, but there must be something that you're worried about.
One of the things is that European healthcare market, as we've spoken here, really is very, how would I say, it's very political. So we're talking about savings or innovation models, and there's budget constraints everywhere. But it's so easy to turn the discussion into a political or to something else, and talk about people's reactions or perceptions of healthcare. So it's very easy field to play in media, really. And there is a lot of information asymmetry between people inside the market and patients, really, that are customers. So it's really a field that has to be approached with the long perspective, as we've heard today. At the end of the day, it's also structured, and it's also science-based. So if you can show that your stuff is good and it works, eventually it will attract interest.
Well, Ville, Öhman, thank you very much for being with us on INSEAD Knowledge.
Thank you so much.